Thanks for tuning in here to Spotlight Now on Hawaii News Now. Joining us live here now in studio is Tommy Johnson, who is the Director of Corrections and Rehabilitation here for the state of Hawaii. Thank you so much for joining us.
Thank you for having me.
Want to begin with just your overall role in this department. One significant thing to note is that there is actually a name change for this department overall. If you can speak to your role and the significance of why this change happened, that may catch some people by surprise, the significance of a name change.
Okay, well, two things. One, my role as a director is to move the department forward and to make sure we're providing humane conditions with evidence-based programs and protection to the public in our correctional facilities. The name change came about because we needed to do a paradigm shift. So last year, the legislature passed a bill that created the Department of Law Enforcement and redesignated the Department of Public Safety to the Department of Corrections and Rehabilitation. So all the law enforcement entities went with the Department of Law Enforcement, and now we have just the correction side and the program side of the house. So this paradigm shift allows us to change from what some may see as a punitive corrections model to one that is more evidence-based, culturally sensitive, and reach in wraparound services so we can have better outcomes and reduce recidivism for the offenders that are sentenced to our custody and care.
Tell us about what rehabilitation looks like. Like, I know that it'll differ very widely depending on the offense and the kind of person that you're dealing with, whether they have a violent past or not. But sort of broad strokes, when we talk about rehabilitation in the corrections department, what does that actually look like?
Well, it looks like professionals providing accurate evidence-based assessment instruments to determine a person's level of risk and needs and what their treatment and educational needs are. It looks like professionals providing those evidence-based services to them. And when I say evidence-based services, I mean educational services, substance abuse treatment services, mental health services, and case management services so that we can make sure they're successful when they get out. So we do a pretty good job of assessing a person's risk and needs when they come in. We have to do a better job of what is that person's reentry needs. And so we created the Reentry Coordination Office, and we're starting to put in place now what we call reach and wraparound services. Does the person need an ID card? Do they need a replacement birth certificate, Social Security card? Would they qualify for veterans benefits to restart up when they got out? Would they qualify for TANF benefits? Would they qualify for Medicaid or Medicare? So those are the things we're looking at to help them transition out. In addition to that, we need to provide them with employable skills where they can earn a living wage, not minimum wage, but a living wage, and we need to help them find appropriate housing. That's the key here in Hawaii.